Welcome to a deep dive into the world of Mounjaro, a medication making waves for both type 2 diabetes and weight loss. You've sent us some research on this potential game changer, and it looks like you're looking for the real deal, the science behind its effectiveness, the potential long-term implications, and of course those side effects everyone's talking about.
It's definitely more than just hype. The dual action mechanism is what's really captivating the medical community.
Right, it's not just mimicking one hormone involved in blood sugar and appetite, but two, GIP and GLP-1. What's the significance of that for someone who might be considering this drug?
Well, think of it like this. Ozempic, another popular medication in this class, only works on GLP-1. That's effective, but Mounjaro takes it a step further. By activating both GIP and GLP-1 receptors, it might be tapping into a more powerful pathway for not just weight loss, but also improving insulin sensitivity and potentially protecting against those long-term complications of diabetes.
So it's almost like hitting the problem from multiple angles.
Exactly. And early research suggests that this two-pronged approach could be leading to more significant and sustained weight loss compared to medications that only target GLP-1. This is still under investigation, but it's a promising avenue.
Okay, that makes sense. But before we get too carried away with the potential benefits, let's talk about how it actually works in the body.
Sure. So when you inject Mounjaro, it basically tells your pancreas to release more insulin when you eat. This helps your body use glucose for energy more effectively, keeping your blood sugar from spiking.
Right, and that's crucial for managing diabetes. But I'm also curious about the weight loss side of things. It seems like Mounjaro is really generating buzz for its ability to help people shed significant pounds.
Absolutely. And the way it works for weight loss is quite fascinating. Mounjaro acts on your brain to decrease appetite and increase feelings of fullness. It also slows down gastric emptying, which means food stays in your stomach longer, further contributing to that feeling of satiety.
Interesting. So it's not just about willpower or cutting calories. It's about actually changing the way your body responds to food.
Precisely. It's about targeting those underlying physiological mechanisms that drive hunger and fullness. And that's what makes it so compelling for people who have struggled with traditional weight loss methods.
You mentioned earlier that Mounjaro is showing some promising results when it comes to weight loss, even compared to other medications in its class.
Yes, in clinical trials, Mounjaro has consistently outperformed other GLP-1 receptor agonists in terms of weight loss. Some studies have shown that people taking Mounjaro lost an average of 20% of their body weight, which is significantly more than what's typically seen with other medications.
Wow, 20%, that's a substantial amount. But I'm also wondering about the long-term sustainability of that weight loss.
That's the million-dollar question, and one that researchers are still investigating. However, early data suggests that Mounjaro might help people keep the weight off for longer periods.
It would be amazing if Mounjaro not only helped people lose weight, but also provided the tools to maintain a healthy weight long-term.
It certainly has the potential to revolutionize the way we approach weight management. But, and this is a big but, we need more long-term data to confirm these initial findings.
Right, it's still relatively early in the game. Speaking of things we need more information on, let's talk about the potential downsides of Mounjaro. There's been a lot of talk about side effects.
Yes, unfortunately, no medication is without its risks, and Mounjaro is no exception.
What are some of the most common side effects people might experience?
The most frequently reported side effects are gastrointestinal in nature. Things like nausea, vomiting, diarrhea, and constipation.
Okay, so not exactly pleasant. Are these side effects typically mild, or can they be more severe?
It really varies from person to person. For some, the side effects are mild and manageable, maybe some mild nausea that subsides after a few weeks, but for others, they can be more debilitating and may even require medical intervention.
That's concerning. Are there any specific factors that might increase someone's risk of experiencing these side effects?
A history of gastrointestinal issues might make someone more susceptible. And as with any medication, dosage plays a role. Higher doses tend to be associated with a greater risk of side effects.
So starting low and slow is probably a good approach.
Absolutely. That gives your body time to adjust to the medication and can help minimize those initial side effects.
Now, besides the gastrointestinal issues, are there any other potential side effects that people should be aware of?
Yes, there are a few others. Some people report headaches, fatigue, dizziness, and injection site reactions.
Okay, so it's not all sunshine and roses. But are there any side effects that are considered particularly serious or that would warrant immediate medical attention?
Yes, and these are the ones we really need to discuss. While rare, there are a few serious concerns with Mounjaro. One is hypoglycemia, or low blood sugar.
This is something you hear about with other diabetes medications as well.
Right, but because Mounjaro is so effective at lowering blood sugar, the risk of hypoglycemia might be heightened, especially for those who are also taking other diabetes medications like insulin.
I can see how that could be a dangerous combination. So monitoring blood sugar levels regularly is critical.
Absolutely. It's important to be aware of the signs of hypoglycemia, things like dizziness, sweating, confusion, and even seizures. If you experience any of these symptoms, it's crucial to seek medical attention immediately.
Okay, so hypoglycemia is one serious concern. What else should we be aware of?
Another potential issue is gallbladder problems, particularly gallstones. This is often linked to rapid weight loss, which, as we've discussed, Mounjaro can cause.
So it's almost like a side effect of a side effect.
In a way, yes. Rapid weight loss can alter the way your gallbladder functions, increasing the risk of gallstone formation.
And those can be quite painful.
They can be. Symptoms of gallstones often include severe pain in the upper right abdomen, nausea, vomiting, and fever.
So if you're experiencing any of those symptoms, it's important to get checked out by a doctor.
Exactly. And there's another serious, albeit rare, side effect that's important to be aware of: acute kidney injury.
Kidney problems.
Yeah,
That sounds scary.
it can be. It's not entirely clear why Mounjaro might increase the risk of acute kidney injury, but it's thought to be related to its effects on blood sugar and blood pressure.
So it's not directly damaging the kidneys, but rather its effects on other bodily systems might indirectly impact kidney function.
That's the current thinking. This risk is further heightened for individuals who are already dehydrated or have pre-existing kidney issues.
So staying hydrated is key, as always, but especially for anyone taking this medication.
Absolutely. And this is why working closely with your healthcare provider is essential. They can monitor your kidney function, adjust your dosage if needed, and address any concerns you might have.
Okay, so we've discussed hypoglycemia, gallbladder problems, and acute kidney injury. Are there any other serious side effects associated with Mounjaro?
Yes, there's one more that carries a significant warning: an increased risk of thyroid C-cell tumors, including thyroid cancer.
Whoa, that sounds serious. Tell me more about that.
This is where things get a bit more complex. This risk was primarily identified in rodent studies, and it's not yet fully understood how it translates to humans. However, the FDA requires a black box warning on Mounjaro's label, highlighting this potential risk.
A black box warning is the most serious type of warning the FDA can issue, right?
Exactly. It means there's a potential for serious or even life-threatening adverse effects, and it's something that both healthcare providers and patients need to be aware of.
So should everyone be worried about developing thyroid cancer if they take Mounjaro?
Not necessarily. The risk is still being studied in humans, and it's important to remember that animal studies don't always perfectly predict what will happen in people. However, for anyone with a personal or family history of thyroid cancer, Mounjaro is generally not recommended.
Okay, that makes sense. So open communication with your doctor about your family history and any concerns you might have is crucial.
Absolutely. They can help you assess your individual risk factors and weigh the potential benefits against the potential downsides.
Now, we've talked about a lot of potential side effects, some more common than others, and some quite serious. What about long-term effects? Mounjaro is still relatively new, so are there any unknowns we should be considering?
That's a great question, and it's something that researchers are actively investigating. While we don't have definitive answers yet about all the potential long-term effects, there are a few areas where we need more data.
Okay, let's hear them. What are some of the long-term concerns scientists are still looking into?
One area is the potential for kidney damage with prolonged use. While we talked about acute kidney injury, there's also the question of whether Mounjaro might have subtle effects on kidney function over time, particularly for people who may already have some degree of kidney impairment.
So regular checkups with a doctor, even if you're feeling fine, are probably a good idea.
Definitely. Monitoring kidney function through blood and urine tests can help detect any early signs of trouble.
What else are researchers investigating in terms of long-term effects?
Another area of interest is the potential impact on the pancreas. While Mounjaro stimulates insulin production, there's a question of whether this constant stimulation could over time lead to any negative consequences for pancreatic health.
So it's about finding that balance between stimulating insulin production when it's needed, but not overworking the pancreas in the long run.
Precisely. And this is where ongoing research is crucial.
Now, we've been focusing a lot on the use of Mounjaro for people with type 2 diabetes, but it's also gaining popularity for weight loss in individuals who don't have diabetes. Is that safe and effective?
That's a hot topic right now. While Mounjaro isn't explicitly approved for weight loss in non-diabetics, many doctors are prescribing it off-label for this purpose.
Off-label prescribing, what does it mean exactly?
It means a medication is being prescribed for a condition or purpose that's not officially listed on its FDA-approved label.
Okay, so it's legal, but it means the medication hasn't specifically been studied and approved for that particular use.
Right. And it's important to remember that off-label use doesn't come with the same level of regulatory scrutiny and safety data as on-label use.
So for someone without diabetes who's considering Mounjaro for weight loss, what are the key things they should know?
First and foremost, the potential side effects we discussed earlier apply equally to individuals with and without diabetes.
So the gastrointestinal issues, the thyroid concerns, the potential for kidney problems, it's all still on the table.
Exactly. And it's crucial to have a frank conversation with your doctor about these risks and weigh them against the potential benefits of weight loss.
Now, I know a lot of people are comparing Mounjaro to other weight loss drugs, like Ozempic and Wegovy. What's the difference between these medications, and how does Mounjaro stack up?
It can be confusing because they all work on similar pathways in the body, but there are some key distinctions. Ozempic and Wegovy both belong to a class of drugs called GLP-1 receptor agonists, meaning they work by activating the GLP-1 receptor.
And Mounjaro also activates the GLP-1 receptor, but it has that added action on the GIP receptor.
Right. Precisely. And this dual action seems to give Mounjaro an edge when it comes to weight loss. Studies have shown that people taking Mounjaro tend to lose more weight compared to those taking Ozempic or Wegovy.
So it's like a more powerful version of those drugs.
In a way, yes. But it's not just about potency, it's also about the potential for broader metabolic benefits.
What do you mean by metabolic benefits?
By activating both the GLP-1 and GIP receptors, Mounjaro might have a more comprehensive impact on metabolic health, improving insulin sensitivity, reducing inflammation, and potentially even protecting against cardiovascular disease.
So it's not just about weight loss, it's about improving overall health markers.
Exactly, and that's what makes it so intriguing.
But as with any medication, there's a balance between potential benefits and potential risks. And cost is also a major factor to consider.
Absolutely. Mounjaro is one of the more expensive weight loss medications on the market, and insurance coverage can be tricky. Some plans may not cover it at all, while others require prior authorization.
So it's not as simple as just asking your doctor for a prescription. You have to navigate the insurance maze as well.
Unfortunately, yes. And this is where advocating for yourself is crucial. If your doctor recommends Mounjaro, but you're facing insurance hurdles, don't be afraid to ask for help.
What are some strategies for advocating for yourself in this situation?
Start by contacting your insurance company directly to understand their coverage policies for Mounjaro. If they deny coverage, ask for a clear explanation of the reasons for denial and inquire about the appeals process.
So don't just take no for an answer. Be persistent and explore your options.
Exactly. And remember, your doctor can be a valuable ally in this process. They can provide documentation supporting the medical necessity of Mounjaro and help you navigate the appeals process.
It's a team effort. Now let's shift gears a bit and talk about the societal implications of Mounjaro. It seems like this drug is generating a lot of buzz, both positive and negative.
It's fascinating how Mounjaro is sparking broader conversations about body image, weight stigma, and the ethics of medical interventions for weight loss.
It's not just a scientific advancement, it's a cultural phenomenon. What are some of the concerns people are raising?
One concern is that the availability of a highly effective weight loss medication like Mounjaro could exacerbate the pressure to conform to unrealistic beauty standards and potentially lead to increased body dissatisfaction.
So it's not just about the drug itself. It's about the societal messages that surround weight and appearance.
Right. And there's also the concern about equity and access. Mounjaro's high cost could create a divide where only those with financial resources can afford this powerful tool, while others are left behind.
That's a really important point. Weight loss shouldn't be a privilege.
Exactly. And this raises questions about healthcare disparities and the need for policies that ensure equitable access to effective weight loss treatments.
Are there any initiatives or policy changes being discussed to address these concerns?
Yes, there are several organizations and advocacy groups pushing for policy changes that would make weight loss medications like Mounjaro more affordable and accessible. Some are advocating for insurance coverage mandates, while others are calling for price negotiations to lower the cost of these drugs.
It sounds like there's a lot of work to be done to make these potentially life-changing medications available to everyone who could benefit from them.
Absolutely. It's a complex issue with both scientific and societal dimensions.
Okay, so we've covered a lot of ground here. We've talked about how Mounjaro works, its potential benefits and risks, the comparisons with other weight loss medications, and the broader societal implications. But I want to bring it back to the individual level. What advice would you give to someone who's considering Mounjaro, whether for diabetes or weight loss?
My advice would be to approach this decision thoughtfully and with a realistic understanding of both the potential benefits and risks. Don't let the hype overshadow the facts.
So be an informed consumer.
Exactly. Do your research, read about both the pros and cons, and talk to your doctor about your individual health history and goals.
What are some key questions people should ask themselves before starting Mounjaro?
Start by asking yourself, what are my goals for taking this medication? Am I looking to improve my blood sugar control, lose weight, or both? Then consider, am I comfortable with the potential side effects, and am I prepared to manage them?
So it's about weighing the pros and cons and making an informed decision.
Precisely. And don't forget to consider your lifestyle. Are you willing to make dietary adjustments, exercise regularly, and monitor your blood sugar if needed?
It's not a magic bullet. It requires effort and commitment.
Right, and it's important to think about cost and insurance coverage. Can you afford this medication, and is it covered by your insurance plan? If not, are there alternative options that might be more accessible?
Those are all excellent questions to consider. And of course, having an open and honest conversation with your healthcare provider is essential.
Absolutely. They can help you navigate these questions, assess your individual risks and benefits, and create a personalized treatment plan that's right for you. It's a partnership, and communication is key.
Now, with all this information in mind, how do we make sense of the conflicting narratives surrounding Mounjaro? On the one hand, it's hailed as a revolutionary breakthrough. On the other hand, there are concerns about side effects and long-term implications.
It's important to remember that with any new medication, particularly one that's as potent as Mounjaro, there's a learning curve. We're still gathering data on its long-term effects, and it's likely that our understanding of this drug will continue to evolve.
So it's a journey of discovery, both for the medical community and for individuals who are considering this medication.
Exactly. And it's crucial to stay informed, be aware of the potential risks and benefits, and make decisions that are aligned with your individual health goals.
Okay, so we've talked about the science, the side effects, the comparisons with other medications, the societal implications, and the importance of personalized decision-making. Is there anything else our listeners should keep in mind as they navigate this complex landscape?
I think it's important to remember that while Mounjaro can be a valuable tool for some people, it's not a solution for everyone. There's no one-size-fits-all approach to health and wellness.
So true. We're all unique individuals with different needs and goals. What's right for one person might not be right for another.
Exactly. It's about finding what works for you, empowering yourself with knowledge, and making informed choices that support your overall well-being.
That's a great message to leave our listeners with. Empower yourself, do your research, and make choices that align with your individual health goals. And don't be afraid to ask for help along the way. Your healthcare provider, support groups, and loved ones can provide valuable guidance and support.
Absolutely. It's about finding what works for you and empowering yourself to make informed decisions about your health. That's the most important thing.
Yeah, couldn't have said it better myself. All right, so we've explored the ins and outs of Mounjaro, how it works, the potential benefits and risks, the societal implications, and the importance of personalized decision-making. But before we sign off, I want to leave our listeners with one final thought-provoking question to ponder. We've talked about how Mounjaro mimics hormones that naturally occur in our bodies. It's essentially hijacking our biology to achieve specific outcomes: weight loss, blood sugar control. This raises a really interesting ethical question. As we develop more and more medications that can powerfully alter our biology, where do we draw the line? At what point does manipulating our hormones for weight loss or other desired outcomes become a slippery slope?
That's such a crucial question, and one that I don't think has an easy answer. It forces us to grapple with fundamental questions about what it means to be human, how we define health and wellness, and the role of technology in shaping our bodies and lives.
It's a question that deserves careful consideration and open dialogue. And I think it's something our listeners can continue to reflect on as they navigate the ever-evolving landscape of health and medicine.
Absolutely. It's a conversation that needs to happen on a societal level, involving scientists, ethicists, policymakers, and the public.
This deep dive has been quite a journey. We've explored the science, the ethics, and the personal implications of this groundbreaking medication.
I always love these deep dives with you. It's fascinating to unpack these complex topics and explore all the different angles.
Me too. It's a reminder that knowledge is power, and that informed decision-making is crucial, especially when it comes to our health. Thanks for joining us on this deep dive into the world of Mounjaro. We've talked about how Mounjaro mimics hormones that naturally occur in our bodies. It's essentially hijacking our biology to achieve specific outcomes: weight loss, blood sugar control. This raises a really interesting ethical question.
I see where you're going with this.
As we develop more and more medications that can powerfully alter our biology, where do we draw the line? At what point does manipulating our hormones for weight loss or other desired outcomes become a slippery slope?
That's such a crucial question, and one that I don't think has an easy answer. It forces us to grapple with fundamental questions about what it means to be human, how we define health and wellness, and the role of technology in shaping our bodies and lives.
Yeah, it's a question that deserves careful consideration and open dialogue. And I think it's something our listeners can continue to reflect on as they navigate the ever-evolving landscape of health and medicine.
Absolutely. It's a conversation that needs to happen on a societal level, involving scientists, ethicists, policymakers, and the public.
Well, this deep dive has been quite a journey. We've explored the science, the ethics, and the personal implications of this groundbreaking medication.
I always love these deep dives with you. It's fascinating to unpack these complex topics and explore all the different angles.
Me too. It's a reminder that knowledge is power, and that informed decision-making is crucial, especially when it comes to our health. Thanks for joining us on this deep dive into the world of Mounjaro.